start to record.
I just actually started.
Thank you.
In your mid-sentence, I was thinking, oh, it's time.
Thank you, Rana. Okay, so I will put a link to the agenda in the chat as well. Or let's see, I'll do that. I'm not used to doing all of this, guys. I'm, not really good at technology, but I am trying my best. So please bear with me. So again, welcome. And I just have an announcement to make. Sivan has stepped away for a little bit in order to deal with some personal things. She is not going to be a part of Medicare for All Connecticut. She is just dealing with, like a lot of us, housing issues. So hopefully she will be back soon, but we don't want Sivan to be inundated with a lot of emails and you guys not getting any responses. So if you need something or you have questions or concerns or any ideas, you can always send anything to info@medicareforallct.org or to my personal email or Rana's personal email. And I'm going to put those in the chat as well. Sivan will always get a copy when you send the emails to info@medicareforallct.org. So she will always still be in the loop. We still do speak to her. It's just that she has to take care of this now. But she is never far. But I just want to make sure you guys understand that that's why she hasn't returned emails or anything like that. So if you need us, please reach out to myself or Rana, and we will get back to you as soon as we can. And you guys know that she is really needed and really dependent upon. So if we don't get back to you like that, you guys understand that she kind of was my personal backbone when it came to this organization. So it's going to take a little getting used to not have her around. And so now the topic that is the most important to me right now and to you guys, which is going to be a part of our activist meeting that will be rescheduled for tomorrow and then again next Wednesday, will be in regards to a Husky for All and Husky for All study bill to phone bank all of our legislators, which is why we ask you to put that information in the chat. So anyone who wants to participate in the phone banking of their legislators, as you did put your information in, whether or not you were interested in talking to your legislators, that's going to help us to kind of split up all of the 47 or something like that between the reps and the senators.
I think it's more than that.
Oh,
yeah, but I don't remember. I've actually started updating the list because between now and election day, because of the redistricting, actually some districts cover different towns than they have in the past. So we have to sort of update things. And of course, with many current legislators retiring after this year, we're going to have a different list from the past 2 years. And some of the new legislators probably don't know a lot about this subject yet, and they might be particularly important for us to get in touch with, even when they're just starting out. So, there's an understanding that this is really a pressing issue for so many individuals in the state and so many municipalities in the state.
Yes, yep, definitely. So yes, that like Rana said, there are several, which I did get a good piece of information from one of the meetings I was at last night. My little nemesis is not running again. So State Rep Aurora is not running. So that made my legislative session much easier. One less person to have to not convince. But I will have to say that I think that the last time we did this, we really had a lot of good conversations with legislators, and you never know who you could actually get a good connection with and who you could start a new relationship with that you didn't expect. For example, doing other advocacy work, we had a champion in Senator Kelly, which we didn't expect to get, but he really championed a lot of the Medicaid portion of something that we were trying to get through. And it was unexpected, but it was certainly welcomed. You know, we don't care. Thank you, State Rep Winkler. Thank you. 187. I had the 7 right. So we don't care where the support comes from, whether it be Democrat, Republican, Independent, Green Party. It doesn't matter. Medicare is a human right. Everyone should have health care, period. And we really should try to approach more of the people that we feel like don't share our values as it being a human right, and make sure that we push toward the economic value of Medicare for all, expanded and improved Medicare for all. You know, because then we can hopefully bring some more people on board. And we really should also concentrate on the committee chairs. And although that will be changing, now is a good time as any to start building relationships with those who are still existing and will most likely continue. So you never know who is going to be the next champion, and we certainly need to continue to build our list of champions. So that's, you know, something else that we would like to continue doing, is building relationships with all of our legislators. And that's one of the most important things that we can do as a group.
I was going to just add one thing also. We are, well, I think we announced last month that we had received official notice of our 501c4 status. But one of the things that we did a little bit in last year's municipal elections, but are planning to do more this year with the legislative elections, is to offer endorsements. No money, just endorsements to candidates who are supportive and committed to expanding to a single payer system, taking the steps. So we do have a questionnaire. We are planning to send it to candidates this year, not just legislators. We're in the process of compiling the list. And I'm going to just share my screen just so you can just get an idea that there is going to be a survey that legislators or prospective legislators will be able to fill out in order to seek our endorsement. But we're hoping to invite candidates, even if we're not assuming that they're supporters, because it's a tool to educate them about the issue as well. So that link will be, I don't know, I guess I could put the link to the survey in the chat, but we will be getting contact info for all the candidates within the next week and invite them to fill out the survey.
Thank you, Rana. Thank you. I appreciate that. Okay. All right. So We are also starting a Medicare for All. We are starting new Medicare for All resolutions in Middletown and Fairfield. Dana Asby, one of our board members, will be the point person for the Middletown resolution, and myself and Rana will be the point people for Fairfield, which will be in honor of our late steering committee member, Josh Hermson. And we're going to be working closely with his family on this effort. And we just want to wait a little bit longer. And then we'll contact them to hopefully door knock, canvas, table with them and the Democratic Town Committee that we spoke to. But if anyone is interested in helping with these resolution efforts, please, again, email info@medicareforallct.org or myself or Rana. And if you have any other towns that you have events in, or you think we should be getting out there and educating more people about Medicare for All, certainly let us know. And we will try our best to have someone get out there and do some tabling, to do some more educating of all of our residents. Because I think the more people we educate, the more people we can build power to the movement. Does anyone have any questions so far? And welcome, Rep. Michelle.
I'll chime in just to underscore how important what you just said was about the local municipal resolutions. You know, I'm a strong advocate for pursuing those. We just had a successful effort in Hamden, where I live, and it really was just a great way to get out and talk to ordinary people and explain to them single-payer healthcare in a way that lets you connect with them directly. And by pursuing a non-binding resolution through your local legislature, you know, it gives you a chance to write op-eds and get those published in newspapers. It gives you a chance to make the arguments for single-payer healthcare and health justice on the public record, with people watching, with town clerks writing everything down. And then when and if you're successful, you know, it makes the news. It's just a great vehicle to build support from the ground up. And that's how something like this needs to be done. So I really do encourage everyone to A, participate in existing resolution efforts, and B, you know, find new towns that you think are fertile for something like that.
Thank you, Pete, so much. Yes, we've done 5 so far, and it's been great. And even though we have passed resolutions in a lot of the towns, we're still there because we're still passing on information and building more power in the area, because people are really interested, especially given the climate of healthcare. It just continues to decline. So without further ado, if anyone has any further questions, please let me know. Any other comments from anyone? I would just like to point out that Rep. Winkler did put in the chat that personal relationships and gratitude are important, and perhaps volunteering 3 days on someone's campaign could prove valuable. I don't disagree. I have definitely volunteered on a few people's campaigns that I actually believed truly in the person and their message. And I still have relationships to this day with them, even though they are no longer in office. So I don't disagree, Rep. Winkler. Thank you. Any further comments or questions? Okay. Well, now, my friend Logan Martinez from National Jobs for All Network is here. He is an amazing advocate. He is, I know Pete put his bio out there, but as a person, as a human being, I really do look up to Logan. He does a lot of things for a lot of people, and him and Professor Zach who is here tonight as well, have really kept me going and engaged in the National Jobs for All and our little Connecticut posse that we have assembled. So Logan, please go right ahead and take it away.
Okay, I thought I had a few more minutes at 7:30, but I could start now. This is a great audience. It's a good turnout. I'm a member and involved in the Single Payer Action Network here in Ohio, and been involved in single payer for over 30 years. And so I'm very sympathetic and supportive of what you guys are doing and what Holly's been doing and the folks here. It's a critical struggle. Very, amazing that, we still don't have it, though there's a huge movement here in Ohio and around the country that's been pushing it. And at this point, I just looked yesterday, there's 121 co-sponsors in the House of Representatives, which I think is the most that we've ever had. And you would think it would be in the news media every other day about the struggle for healthcare. They talk about the cost and everything else, but rarely, if ever, do you hear them, at least nationally and locally, ever say a word about single payer. Now, there's been news conferences and things where they do cover us, but it's rare. I'm like Holly said, she's been working with us. We had a town hall meeting last year in New Haven, and Holly and the group here was one of the co-sponsors. And we had an excellent cross-section of groups that came together to talk about everything from healthcare to jobs to world peace, and had some really excellent presentations. The issue of jobs and healthcare are kind of linked at the hip here. They go hand in hand. The first thing that happens to a worker when you lose your job is you lose your unemployment benefits. I mean, you gain unemployment benefits, but you lose health care. And that loss of health care is extreme. It leads to the leading cause of personal bankruptcy. It's a leading cause of home foreclosures. On average, somewhere between 500,000 and 1 million Americans lose their homes every year because of home foreclosures. And it's usually complicated. Of course, you lose your job, you lose your health care, and you don't have income. Housing is one of the things that people end up suffering. It's amazing. Most countries, as I think everybody here knows, there's no charge for health care. And so you don't lose your health care when you lose your job. And in this country, as I suppose people here know, there's a built-in mentality among workers not to go to the doctors. That people have been socialized because of the expense, because we are thought to be he-men and strong people. You just got to work through it and get over it. And every day, people die prematurely because of the lack of health care. Now, it's linked in other ways as well. John Conyers, who introduced single payer health care years ago and brought it to this point, also introduced the bill that we're supporting for Jobs for All. It's the National Jobs for All Full Employment Bill. It would create full employment through a number of mechanisms. Mainly, though, it would give each community the ability to create projects that would put people to work. And it gives that incentive to government and to nonprofits and to community groups all the way up from the local level to the state to the national level. And we give the money, it has the finances in it to finance it so that people would get good pay and good benefits and help rebuild our society. I don't know about Connecticut. I've only seen a small part of Connecticut. You guys seem to be better off than most places, but I'm sure in some of the cities you have a housing problem, homelessness. You know, on any given night, there's 500,000 homeless people in the United States, and that's the low estimate. Most of the homeless groups, you know, a lot of people are in transition and are moving, and it's amazing that the richest country on the planet doesn't have health care. We don't have housing. And while, you know, there is somewhat of a supposedly a workers shortage, in most places, there's still large pockets of unemployment, especially in minority communities, and especially in low-income communities. And if you go to our website, I put it in the chat, you will see on there what we call as the real count, the total count of unemployment. Real unemployment is almost twice of what they say in the national numbers. And one of the things, there's a report that came out yesterday that points out one of the main things, the workforce has not grown in the last 2 years. And so while unemployment is the same as it was when Trump was there the last couple months before the pandemic, the level of real people working is about the same. And so we've really not gained much in the last 2 years as far as real jobs. Are people hearing me okay, Holly? Okay, good. I'm not sure. Healthcare and unemployment are structural crises in the capitalist system. And healthcare, or the Medicare for All bill and the Jobs for All bill, are ways of fixing it. They're structural fixes to the capitalist system. Unemployment has been used to keep wages low, to keep benefits low. And healthcare is one of the things that leads to the most strikes in this country. The workers are always trying to push onto the workers the burden of paying more and more of the healthcare, higher deductibles, higher co-pays. Excuse me, my phone's ringing. I don't know who it is, but someone will take care of it. I will. Pardon me. What we need to deal with these is unity and grassroots movement. Most workers or middle class, most people in this country have heard of single payer. After 30 years of working on it, they may not fully understand it. They may not really understand it, but when asked in the polls, the majority of Americans support it. That's why we have the co-sponsors we have. And most people would support full employment, except that is not put on the agenda right now. We're working to have a new bill introduced, and I'll talk about that in a minute. But bringing groups together like this, bringing together unions, religious activists, community groups at every level is going to be key to change. Until we work together and people really realize that we're in the same boat. And all around us, people are drowning. People are becoming homeless, losing their homes. People are dying prematurely because they don't go to the doctor or they don't have adequate health care. We have the best healthcare system in the world, but if you don't have access to it, it's beyond your reach. And if anybody's been to the emergency room, what they do now is they make people come in, especially low income and poor people, and you sit there all day waiting to be seen. And so there's this, you know, they use that to drive people away. And with the COVID and the pandemic, most people don't want to end up in the emergency room. But they don't have family doctors, low-income people. So the challenge before us, before our whole society, is how do we effectively reach more people and mobilize those people? And I have some ideas. I'm sure you have some ideas. We've canvassed, we've gone door to door, we've done phone banking, but we need to really not only lobby the legislators, we have to really continue the educational process. I know here in Ohio, SPAM is constantly, the local chapters are constantly doing outreach and constantly trying to educate people. And I think it's had its impact. I think we're on the edge, but we can't allow all this war and divide and conquer. You know, what we see is the division between the Trump supporters and the Democrats and the liberals they're constantly dividing us here. And what we have to do is use single payer, the jobs for all, and economic justice and the rights of people to stand up to bring people together. And I will stop there, and I'd love to take your questions and share, you know, your ideas, and hopefully we'll come up with some ideas that will move things forward.
I actually have a comment if no one else has any other questions. Well, my comment is that my issue was, you know, we needed to make sure that people with disabilities are covered as well. And that is going to be, or is part of the bill. Correct, Logan?
Yes. Oh yeah, we're talking about full employment for everyone.
Right.
So, and we talked about that at our meeting the other day, is that have the wrap around not only for disability, but for ex-felons.
Yeah.
The full employment, John Conyers was brilliant. We worked with Phil Harvey, who's a doctor at Rutgers University, who worked on the bill. And we included a whole bunch of things that would, you know, increase people's ability to maintain their job, transportation, that kind of stuff. And we want to create a work environment that is democratic and empowering people as part of this society. I know I might say a little bit more about the bill. Or, in fact, Zach is a very good promoter of the bill too. And he's on, I don't know if he's still listening, but he's been working with us for several years and is very strong on the jobs issue. But we're on the brink of a possible recession here. And the whole jobs issue is always important for low income and for minority communities, and women. Women make up a big part of the unemployed. And anyway. So
does anyone have any questions? Go ahead, Justin.
Oh, Logan, thanks for your talk. I'm also a big supporter of the federal jobs guarantee, and of course, single payer Medicare for all. Could you tell us a little bit more about yourself in terms of what you do? You know, how you allocate your time for local organizing, what various organizations you work with, and you know which ones you work with the most. It seems like you have your irons in a few different fires.
Well, not as much as I used to. I've gotten a little older, and I've tried to cut back. I used to go to all kinds of community meetings dealing with housing in particular. But everything from DSA, the Green Party, to unions. We've worked a lot with the unions over the years. It goes up and down with the leadership, but
And when you
they
say
know firsthand.
when you say we, you mean the National Jobs for All Coalition? Is that your primary?
That's my primary organization, but I work here locally with a group called the Miami Valley Full Employment, which was a group of unemployed and low-income people. And we've worked on everything from welfare reform to rate hikes on utilities to cutting back of bus services and bus services rate hikes. And so every time it's mainly defensive. The system is attacking working people constantly, rolling back their benefits, taking away things that we've struggled with for years. And part of the response is to defend people's rights and to defend those benefits that people have, defend their jobs. So there's a a large variety of groups, but block clubs, though they've kind of gone down a little bit, but there used to be a big number of block clubs here in Dayton. I'm in Dayton, Ohio, by the way, in case you want to know where I am.
I lived in Cincinnati briefly. So what is a block club? That's the people on your block?
Yeah, yes. It used to be very big, and the unemployment councils in the 1930s would use block clubs to, when people were evicted from their homes or their apartments, they would go out and get the neighbors, and everybody would come together and move people back in and stand up to the police at the door. Occupy did a little bit of that, but on average, hundreds of people are evicted from apartments every month. In New Haven or Providence, I'm sure there are people being evicted all the time.
And could I ask, is there, what are the organizations in Ohio or near you that are pushing for single payer, either in the state or national level? I know the Green Party of Ohio is, but are there others?
Well, we have a state group. I mentioned it, the Single Payer Action Network of Ohio.
Oh, yeah.
And we have chapters in most of the cities here in Ohio. We have one here in Dayton. And I've worked with them for 30 years. Well, I've worked on single payer. That group has only been around 20 years, but single payer actually got a big start here in Ohio. It was one of the first states that a state bill was introduced in. And we had a lot of union support for that bill. But of course, the establishment of both parties did not want it. And of course, it went nowhere.
Yeah.
We're working to have a new Jobs for All full employment bill introduced. And Holly and Zach have a draft of the legislation. And we invite, if Holly could share that with people.
I was just going to ask you if you wanted me to put a link to it, or put a, okay.
Please do so.
Sure, unless Zach, my link isn't working.
Yeah, I can certainly upload that.
There's
That would be awesome.
Oh yeah, I'm here, Logan.
Can you say a little bit about the bill? You're very articulate about it.
Oh, well, sure. I'd be happy to talk about it. So this bill, which was, as Logan said, originally introduced in Congress by the late Representative John Conyers, HR 1000, the Humphrey Hawkins Full Employment Act. I believe I have the full title. I'll upload the latest revision that Logan was talking about that was recently put together by Dr. Phil Harvey and other members of our national board. And just to add a few things, I do have to leave shortly, but I wanted to say a few things about, first of all, about our local group that's working on this, which is the Jobs for All Connecticut. We don't really have a formal name, but you might say alliance or a collective or what have you. And we're looking to bring together a cross-section of people from a variety of organizations to form a statewide jobs and human rights task force. And the idea would be to build power here in Connecticut to fight for a job guarantee at the federal level to support this bill when it is hopefully introduced in the next legislative session at the federal level, HR 1000. Again, I'll drop the copy into the chat in a moment. And also, one of the things we're hoping to do is to advance companion legislation at the state level, which would establish a state jobs program that would become active upon the enactment of the federal legislation. These bills are certainly we would hope that they would pass, but at the very least, it raises consciousness about the importance of guaranteeing employment to everyone as a basic human right. And finally, this, of course, operationalizes the vision of President Franklin Delano Roosevelt and Eleanor Roosevelt as well, with the Economic Bill of Rights that President Roosevelt articulated in 1944 in his State of the Union address, and of course with the rights, the economic human rights that became enshrined in the Universal Declaration of Human Rights. So these are sort of the guiding documents that really animate, in many respects, the work of the National Jobs for All Network, of which I am a proud board member. So that's it for me. I have to leave fairly shortly because, like I'm sure you all know, we all have multiple commitments, but I'll stick around for a minute or two. Thank you.
Thank you, Zach. There's the challenge, you know, it's been up and down with the jobs bill. We had as many as 60 co-sponsors when John Conyers was in there. And it was building great momentum. And I'm not going to go into what happened with him. Very unfortunate. But we've gone through around a number of circles trying to get it reintroduced. And we're on the brink of doing that. The goal here is to create a vision of a kind of society that we think we could be and need to be. You know, they call this the rat race, and it's a good reason. It's a rat race. You know, you get a king rat that gets ahead, like Bill Gates or the guy down in Texas. But we want to have a society in which people are contributing to and are building a environmental and social conditions that will change everybody's human relationships. And full employment is key, central to have that happen.
So I see that Phil has his hand up. Go ahead, Phil.
Hi. I wanted to kind of push back a little bit on a couple of comments that you made concerning emergency departments and healthcare. I'm an emergency physician. I've been one for 40 years. And retired. I retired at the end of July. I was a student of, back in 1975, I was a student of Quentin Young, who perhaps some of you are familiar with as one of the founders of PNHP. And first I would say, please don't say that we have the best healthcare system in the world. Far from it, absolutely far from it. We do some very technologically advanced things and so forth, But as far as the health care that the average person in this country gets, we are nowhere near the best. Our maternal mortality rate is between Cuba and I think Bulgaria. And you can just go all of the World Health Organization indices of healthcare quality. We are nowhere near the top on any of them. Secondly, we don't make people wait in the emergency department hoping that they'll go away. In fact, one of our major metrics is what we call left without being seen, people who registered, waited, and finally gave up and left. We make every effort to keep that rate below 2% for a number of reasons. And the reason that people wait so long is we're overwhelmed. There's a failure of our basic healthcare system that deprives people of the ability to see a family doctor, a personal doctor, et cetera. And when they need whatever problem, health problem that arises, when it needs to be seen in a relatively short period of time, regardless of whether it's life-threatening or not, they come to the emergency department. So we do the best we can. We don't like having people wait 3, 4, 5 hours, but that's the nature of our healthcare system overall. I think an emphasis that ties healthcare and jobs together is this notion that's kind of curiously American, that employers should be responsible for providing healthcare to their employees. And that's largely, the responsibility for that largely lies at the foot of unions who negotiated, starting back in the 50s, healthcare as one of the benefits that they obtained through employers, but offered as a benefit of working. And there's a strong history of resistance by unions to the notion of Medicare type healthcare that has nothing directly to do with employers, where everybody in the country is on an equal footing as far as their need for and right to healthcare. I would just, well, I'll stop there, but we don't have the best healthcare system anywhere in the world. We have by far the most expensive one, but we deliver far less bang for the bucks that we spend on healthcare.
Yeah, could I chime in on that?
Go right ahead.
Yeah, Phil, thank you very much. I agree with you on one thing very clearly in terms of, you know, how people are treated in the emergency room and our lack of being the best healthcare system in the world. I really have to disagree with you about the role of unions. The reason the unions did that, and it is true that the unions started negotiating healthcare, but the reason they did that was because wages were frozen by the federal government during World War II. And the only way they could deal with it is by negotiating health benefits and pensions, okay? And so that's the background of it. And some of us are trying to get unions more involved in that. And after the elections, I plan to get more involved, and I'll be talking to Zach and to some other labor people who are on the call and who are members, but trying to get unions more involved. There are a number of labor endorsers of Sanders' new bill, national unions who are endorsing that bill. And after the elections, I plan to work on getting Medicare for all, getting labor for a single payer activated again. And I wish the workers at Yale New Haven were organized, except for the dietary workers, which I helped organize in 1972. So Phil does a great job there. The only other thing I would say, we have a real problem with people not getting primary health care. I'm on the board of the Fairhaven Community Health Center. I have been for over 20 years. There's the Hill Health Center in New Haven, there's Fairhaven Community Health Center. There are health centers throughout the state where people can get free health care if they don't have insurance. By law, they have to sign up and they have to get billed for minimal copays. If they can't pay it, they don't get collected. Okay. But Medicare for All nationally and locally needs to really get involved in pushing community health centers as an interim until we can get national health care. That's about the only thing, unfortunately, that came out of PNHP, that work with Quentin and others, Ollie Fine back in those days. So, community health centers were part of that, what came out of that movement. And it was the only thing that came out of it. We didn't get the rest of it that we needed. So, but we need to build on community health centers that we have.
Thank you guys both.
I will not be around probably in October and November. After that, I plan to be in touch, Holly, to get names of people who were in unions and stuff. And Zach, I know. And anyway,
Great.
We'll talk to you all later.
Thank you. We have a few unions we have connections with that help. So I'd love to talk after. Absolutely, Bill. Love to connect that again. That would be awesome. So go ahead, Logan. I'm sorry.
Yeah, I want to thank Phil. I misspoke. I made a generalization about, I agree with everything you said, except for, I think that the explanation about healthcare and the unions. Here in Ohio, the unions were very involved in the initial stages of single payer. And through inertia and political maneuvering, they've become less involved. And I think we really need to focus, especially at local unions, and at least talk to local presidents, get in front of the membership. The national AFL-CIO has endorsed single payer, but most of the unions, there's only about 5 or 6 of them that are really the backbone of that effort. And what we need to do is get the locals involved much more so. And I think we need to do that quick on the jobs issue as well. As far as the emergency room, I think you explained the situation there. It's a real problem that people, 40 million Americans have no health insurance at all. And that leads to it's part of the underclass of America that, I'm a part of and many people are. And the only way that's going to change is if groups like this and ours really make the effort to mobilize them to change it.
Go ahead.
Zach, you want to say something else?
Yeah, I just thought I would chime in on this issue of the institutionalized labor movement and its pursuance of a collective bargaining strategy for healthcare. That, in part, as I think Bill has articulated, is a response to the structures of the system in which it's embedded, and the fact that capital had already pursued this so-called welfare capitalism strategy that made healthcare, in a sense, an adjunct to employment. And, so in some sense, you work with what you have. That said, the more enlightened elements of the labor movement, and I think that's who we want to be appealing to, certainly support things like single payer health insurance and job guarantees. There are, corporatized unions that will never support these kinds of agendas. And so we don't work with them. We don't ally with them. But here in Connecticut, on a more concrete level, I am particularly interested, as one of the members of this Jobs for All Connecticut collective, in making connections with the labor movement. And so I'd love for anyone, Bill, Justin, anyone else who wants to join our Monday meetings, which are once a month. Next one will be on October 11th, 7 p.m. And I will drop my email into the chat. If you wish to get in contact with me, you'll get an email from our wonderful intern, Jennifer Perez, who handles all the organization of this thing. So that's it for me. Thank you.
We may not meet, are we meeting on the 11th because of Indigenous Persons Day? On
the plan was to meet.
Okay, so it's on 10/10.
Yeah, Southern's open. I'm working every day.
Okay, 10/10.
You know, social injustice doesn't take a day off, and neither do I. All right, so that's it for me.
And Sharon, go ahead, please.
Hi, I'm a little new to this. I just want to say I've spent 47 years in nursing as a nurse and nurse practitioner, worked in emergency rooms, and I worked in New Haven in conjunction with many of my patients in Fairhaven Clinic and Bridgeport and those clinics in Marina Village I worked in, and also in Cornell Scott. Worked a lot with Cornell Scott Hill Health Center, especially during COVID and their vaccine program. I'm very concerned that I was a little unclear. I had one question is, does the jobs program look at including health or not including? Because I think when you have a jobs program, if you include health, it gets too messy. And we have to get people healthy in this country to get jobs. And I don't think they should be related, because I think one is held over, and especially for women in this country. And I've spent a lot of years as a neonatal nurse practitioner and as an OB nurse. Mothers who cannot afford to quit their job because of healthcare, but then can't afford to take care of their children and they can't breastfeed. So we have multiple problems because we've linked jobs to healthcare. We must sever the umbilical cord there because it's damaging to everyone and it's a controller. And there is nothing worse than, I was in a community healthcare van. I did a lot of mobile nursing. As a nurse practitioner, that I get a person healthy, you can cure him of his hepatitis and HIV treatments, but I can't get him a job. And they come to me and I can get them housing and they come to me, but what do I do? Sit and look in my room all day? I have to give some value to our society and work. If I have no work, I can't buy a mop to clean my floor. But you can't work if you're not healthy. But if we've linked them both, and now in my retirement, I have noticed that now Medicare for all doesn't include vision, dental, and hearing. What are the most 3 common denominators in older people? And I can speak on one of them. So you can't work. You can't contribute to society, and you can't stay healthy because you can't read your freaking prescription. So I implore you to help figure out how we do this separately and where we attack the best persons for that initiative. And I'd be happy to help. And mostly on health, I know more about that than jobs. Thank you for letting me speak.
Thank you so much, Sharon. So I think the whole point is, I don't believe that it's like, and correct me, Logan, if I'm mistaken, because I haven't read through every single word in the bill as of yet, but I have read most of it. It's not linking healthcare to your job. It is just that they are next to each other, and that if you believe in healthcare as a human right, you believe in job as a human right as well. Am I correct in saying that, Logan?
That's correct.
Okay.
And I don't know if Phil still has another question or comment.
No, I think he forgot to put his hand down, I believe.
Okay. You know, they're parallel efforts. And my opinion is, until we as a society are ready to make those kind of structural changes, and mobilize to the point we can force the system to do that. It's most likely that we're going to have single payer before we have a full employment bill. But I think once we have that momentum, it's like the New Deal. We're going to give the United States a new deal of economic and environmental justice here. And we will, because we're all on the same boat, we will make it happen together. And you know, those things that are left out of Medicare, I don't know, I'm on Medicare too, and it really eats up what little money I have to pay for dental, you know?
So I want to be cognizant of everyone's time. It is a minute after 8. So if you have to go, we understand. If you want to continue, I will hold the meeting open. I think this is a great conversation to have. I don't want to cut anyone off, but I do want to be respectful of everyone's time. So thank you all for being here. Logan, thank you so much for explaining. Everyone, I love having the participation. I appreciate it. And thank you, Sharon, for making sure that there's a huge storm that we're expecting. It is a parallel movement. So it is not linked together. It's parallel. And yes, so that's very important. And I agree. So if you guys want to stick around, that's awesome. Great. I see Tom has a question. Logan, are you cool to hang around for a little bit?
Sure.
Awesome. Thank you. Go ahead, Tom.
It's not so much of a question, but I know at the end of the agenda, you had said you were going to leave time for announcements. I don't know if we're there yet. If we are, I will go. All right, great. This is just real quick. If anyone is interested in the legislative process in as much as how to be an advocate, how to use your own personal lived experience when writing testimony and commuting with your legislators, we are hosting a advocacy training this weekend, Saturday, from 9 a.m. to 1 p.m. And our very own Holly Hackett here is one of the co-teachers, along with Caitlin Comet. It's a really worthwhile class. I'm going to put in the chat my contact information. If you're interested in taking this class, please reach out to me and include a good date, time, phone number. If you want a little more information about what the class entails, you either email me or call me. I put my cell number in there, but it's a quick 4 hours. And when you're done with it, you'll any fears you had about how to approach a legislator will all be gone away, because it's not rocket science, but if you've never done it, it could be a little intimidating. That's what we teach, is how to do that. So that's it. Thank you.
And I had one announcement on behalf of Marilyn Vacher, that the PNHP annual meeting will be in Boston on November 5th. I put the info in the chat, and Marilyn is a good person to contact if you are interested in working on building a PNHP chapter here, which exists, but could use a shot in the arm. So anyway, her contact is in the chat as well.
Does anyone else have any other announcements or any questions for Logan or any one of us? Great. Okay. Everyone have a wonderful evening. Stay dry. Hopefully the storm will let us sleep tonight, unlike last night. So have a good rest of your evening, everyone. Take care.
Thanks, Holly. Take care.
Thanks, Holly.
See you soon. See everyone soon. Take care.